Hello, good afternoon from Geneva. Good morning and good evening, everyone, from wherever you are. Welcome back for another Ask WHO social media live Q&A session. My name is Janawid Deshpanyawat from the Communication Department at WHO headquarters. Again, if you follow us on social media today, actually yesterday, we just kicked off World Antimicrobial Awareness Week on the 18th of November, and the campaign will last until the 24th next Wednesday. This is a very interesting yet very important, even critical health topic that concerns all of us. So that's why we're here today to talk about antimicrobials in general, antimicrobial resistance, what it is, why it's important, and how to prevent it. And it is my great pleasure to have with us in the program today Assistant Director General for Antimicrobial Resistance, Dr. Hanan Balki. Welcome, Dr. Balki. How are you doing?
Thank you, Yanawa. Thank you very much for having me on the event today.
All right, we are very, very pleased to have you here with us today, Dr. Balki. So, to start off our conversation this afternoon, how about you tell our viewers about this week-long campaign? What is the theme this year, World Antimicrobial Awareness Week? What are the highlights that we can expect?
Thank you very much. And again, good afternoon to all of our viewers from around the world. It's a great pleasure to be with you. As Yanawat said, we are kicking off World Antimicrobial Awareness Week. It has now been established to be a continuous week every year, November 18 to the 24th. We had also changed the name of this event from last year from Antibiotic Awareness Day to Antimicrobial Awareness Week. And the reason is antimicrobials is a more comprehensive nomenclature. It includes to include resistance from the different classes of pathogens, viruses, bacteria, fungi, and parasites. The reason why we have it for a full week is because of the necessity of us bringing attention to what has been thought of as a problem for the future, or a problem that is also sometimes misnamed as the silent pandemic. It's an active pandemic. People have been suffering from antimicrobial resistance for decades, and it's about time that we really pay attention. So thank you for joining us, and back over to you, Yana.
Oh, thank you very much for a great introduction. Before I get back to you, I would like to welcome our amazing fans and followers who are joining us from all corners of the world. Today's topic is about antimicrobial resistance, or AMR. In short, to ask your questions, go to the comment section below. We have a whole team working behind the scene to create your questions for us. Dr. Balki, I know you have already mentioned briefly in the introduction, but could you please explain a little bit more what antimicrobials are for those who may not be familiar with the topic or the term?
Great, thank you so much. So antimicrobials, they are actually pharmaceutical agents. So they are medicines that are supposedly to be prescribed by healthcare providers to treat infections based on the specific antimicrobial. So the antivirals are to treat viral infections, antibacterials to treat bacterial infections, antifungi to treat fungal infections, and so on and so forth. Sometimes the healthcare provider needs to treat empirically before having a clear diagnosis of what is causing the illness in the patient. And once the diagnosis is confirmed, supposedly the medication will be continued because it's found to be the right medication, or discontinued or adjusted if needed so. So antimicrobials, they are pharmaceutical agents given by healthcare providers to treat infections in humans. The complexity here is some of these agents are also used in the animal sector to treat or prevent infection in animals, and also to prevent or treat infections within crops.
Thank you so much, Dr. Doggy. That's a very clear explanation. All right, I see we received quite a number of questions already. Thank you very much, everyone. Before we take the first question, well, Dr. Baki, you just told us in a nutshell what antimicrobials are, but what about antimicrobial resistance, or AMR? What is it, and what are some of the major causes that lead to antimicrobial resistance?
Thank you, Yana, with always difficult questions. So, antimicrobial resistance is when those pathogens that we just talked about, the bacteria or the virus or the parasite or the fungi, stop responding to the antimicrobial. So they continue to grow and cause disease even if we're giving those agents, which means that the bacteria, the pathogen, is no longer responding to the treatment. So with that, when that happens, then those pathogens, if they are causing an infection in a human being, they will continue to cause illness, and sometimes it can lead to death. What causes antimicrobial resistance? It's the sheer need for the bacteria, these single-celled agents that want to survive. They have an agenda. They have a very simple yet sophisticated genetic DNA or RNA. They have a specific genetic material that can code for resistance, and they can evade or hide or pump out those antimicrobials once they come into their system so that they no longer respond to the antimicrobials. So when we talk about what makes this actually happen, it's the misuse of an exposure to these agents that allow for the bacteria and the other pathogens to become resistant.
Okay, thank you, Dr. Aki. And now I'll take some of the questions now. One of our viewers today is asking, well, actually, it's a follow-up questions on what you just said to us just now. The question is, are microbial resistance, antimicrobial resistance, and antibiotic resistance the same thing?
Yes, so as I said before, the word antibiotic, it's a much narrow name. Antimicrobials is the antivirals, antibacteria, antifungi, antiparasitics, while the antibiotics are more specific to one of the pathogens, the bacterial pathogens.
Okay.
So in essence, it's the same thing, that it's the treatment for a specific pathogen.
All right, thank you. Okay, another question from one of our viewers on Facebook. What are WHO recommendations regarding restricted use of antimicrobials globally?
That's a great question because I think sometimes the impression is that even in my previous job as a clinician, they assume that when we talk about antimicrobial stewardship or when we address the issue of antimicrobial resistance, that the big aim is to stop usage of antibiotics or antimicrobials. And that's really not the case. The reality is that these are very precious agents and we would like them to be used appropriately. And that's what we call judicious or appropriate use of antimicrobial agents, which means that in a good situation, in a good scenario, you would have a diagnosis and a diagnostic tool that can ensure that you are treating the patient for the right pathogen with the right antimicrobial agent. So we do not wish to prevent access to antimicrobials. In fact, we want the appropriate access to the correct agent with the correct dose for the correct duration of time.
Thank you very much for your great answers. I think all of us, me included, who are watching this live Q&A right now, may want to know how we can prevent antimicrobial resistance. You have any useful tips or any simple steps that we can take to prevent drug resistance or antimicrobial resistance?
Of course, it's a big agenda, and I think that's why people have realized that in 2019, the Director General had elevated this program into a major flagship program within the WHO that is a cross-cutting program so that it can underpin the different areas that need to be addressing this topic. But if we talk about the layperson, the simple individual, it's very important that you take antimicrobials only when prescribed, and it's usually should be given by a healthcare provider. We do hope that they are not dispensed without an accurate diagnosis. We also hope for regular people not to share medications, whether they have leftover antimicrobials, which seems to be a common practice, and to respect antimicrobials as, again, I like to phrase this very clearly, they are pharmaceutical agents. They are not placebo, they are not fever reducing agents, they are not gastric cleansing agents. These are pharmaceutical agents that are needed to kill or stop the growth of bacteria. If you allow me, Yano, just to bring it closer to the audience, you have to understand that you would never take an anti-cancer medication just in case you had cancer, or an anti-diabetic medication just in case you had diabetes. And the same way, antimicrobials are being used most of the time or many times just in case a person has an infection. And another way of misusing it is to compensate for deficiencies and shortcomings in hygiene or infection prevention and control. So we need to solve this problem. We need to solidify a holistic response so that we don't need to use antimicrobials except in the real scenarios and situations.
Well, thank you very much, Dr. Balki. It's a very crystal clear and useful piece of advice. While our team sends over some more questions from our viewers, actually, I have prepared a couple of misconceptions about antimicrobial resistance that we usually come across when we talk about this topic. Perhaps you could help us debunk some of these myths today. So, the first misconception is it true that it's our body that becomes resistant to antibiotics?
The body is not the one that's going to respond to the antibiotic. So the antibiotic are pharmaceutical agents to stop either the growth, the multiplication of the pathogen, or to actually kill it off. So no, it's not the body that becomes resistant, it's the pathogen that becomes resistant.
All right. So the next one is, what will you say if someone tells you that I have never taken antibiotics, so I cannot get a resistant infection?
That's a very important. It's not a myth, actually. It's just a misunderstanding of, because the topic is complex. So even if you're not personally exposed to antibiotics and your gut or your skin flora have not developed resistance, all of us are still at the risk of acquiring a bacteria from either the food, from water, from healthcare settings where infection prevention and control are not top notch. We can still be exposed to bacteria that are already resistant because they were exposed to antimicrobials in the environment or from another patient, and then it gets transmitted from the environment, from the food system, from the food, from water, from meat, from vegetables, or from one patient to another, or from medical devices within the healthcare setting. And these vehicles of transmission of the bacteria have the ability to transmit either susceptible bacteria to antimicrobials or already resistant bacteria to antimicrobials. So the risk is still there, even if you, per se, have not received any antimicrobials in your life.
Wow. Thank you so much. Haven't known that before. Okay. This one I think we came across quite often in the past when we talk about antibiotics. So the misconception is antibiotics can be used to treat colds and flu.
That's a great one. Thank you. You should have started off with that one. So 70% of infections that take place within the community specifically are caused by viral infections. However, within the community setting for the common respiratory illnesses, antimicrobials are usually prescribed. So that's why they would start it, and then a few days later they're feeling better, so they stop using antimicrobials, right? So you've already created a situation where you exposed yourself to antimicrobials, number one, unnecessarily. The viral infection already went away, and you felt that you needed to stop the antimicrobials. So that is one of the ways that that bacteria become resistant to antimicrobials. So antibiotics do not treat viral infections.
Okay. Maybe the last one actually you just already mentioned in your response just now, but I think it would be better perhaps you could repeat that one more time. The last one, the misconception is if I feel better, I can stop my antibiotics.
So, if you were given an antibiotic for a good reason with an accurate diagnosis, for example, a streptococcus pneumonia, um, a Streptococcus pneumonia, a Streptococcus ear infection, a Haemophilus influenza infection, a urinary tract infection from E. coli, you're supposed to complete the course. When you do not complete the course, you're teasing the bacteria. So you're killing off some of them, but you're allowing the rest that were not killed already to actually use that opportunity to develop a mechanism of resistance. So then that bacteria that were left over because they were not fully killed, they will continue to be in your system and maybe transmitted within the environment, and that's how resistance emerges.
All right. Thank you so much, Dr. Baki. Before I get back to you one more time, just a reminder for all of you who just joined us, our program today is on antimicrobial resistance on the occasion of the World Antimicrobial Awareness Week. We have Dr. Hanan Balkhi, Assistant Director General for Antimicrobial Resistance, to answer your questions. You can send over your questions or anything that you wanted to share in the comment section below. So, Dr. Balkhi, here are quite a few questions coming in now. One of our viewers is asking, this one is interesting. What is superbugs? Is it a good thing?
No, not at all. For them, for the bug, it's a good thing because that means that this bug has acquired a lot of genetic material to make it actually resistant to antimicrobials, to the antibiotic. So superbugs is was a lay word, or just to simplify it to the public, that these are bugs that have acquired resistance mechanisms. So that's what is meant usually when superbugs are mentioned.
All right, thank you. The next questions, one of our viewers, Buds Bido, the red shark, is asking, is there any measure or caution taken to prevent animal to human for antimicrobial vaccines?
For antimicrobial resistance, you mean?
Yeah.
So the transmission of
Yep.
bacteria, of resistant bacteria from the animal sector to from the animals to the humans, that can happen in several ways. It can happen if food is contaminated by resistant bacteria. E. coli is one of them. Shigella is one of them. Salmonella is one of them. So if the meat is, or the chicken, the poultry, is contaminated with these bacteria, and then they go into the kitchens or the food preparation areas, and it's actually not cooked well, or even if it's cooked well but you're also preparing vegetables and juices in the same environment, you can transmit those bacteria to the non-cooked consumables and get the infection that way. I think the person who asked the question wanted to ask about vaccines for animals. Maybe that was part of the question. But immunizations there's something called autologous vaccination programs for animals, where specifically for salmonella, where you can vaccinate animals to prevent certain infections. But the fact of the matter is, in preparing food in general, so that the public is aware, and WHO does have guidance on that on their website, is that it's very important that we pay attention to the meat preparation section and thawing the meat within the refrigerators, from freezers to refrigerators, and the food preparation areas, so that we do not contaminate the uncooked food. Because even if the meat and the chicken is contaminated, but you're going to cook it in heat and heat it, so you're probably going to kill off all those bacteria. But if already the transmission of the bacteria went from the meat products to the vegetables and juice products and salads, then the potential is there to get the infection.
All right, thank you. Another question from Rocky Jumapili. Are there plans to have to train to have community engagement and awareness on the use of antibiotics? Are we working with communities and countries?
Thank you very much. I think WHO, through all of its programs, if most of, if not all of its programs, actually, civil society is a crucial partner in all of the work that we do. So I think, and there's already multiple civil society and private sector and communities. We had a beautiful event this morning with the AMR students. So there's so many things happening within the community that they need to be part of this, because the awareness needs to spread far beyond the WHO community can reach. So absolutely, I think all of you, even online with us today, you would definitely have a major role in spreading the information and knowledge.
Yes, absolutely. I totally agree. Uh, I received one question from Juma David asking how often or when do we need to take environment swabs in order to determine antimicrobial resistant patterns.
Excellent. It seems like this person is a public health individual who's in the community, maybe. Or maybe in the hospital. So this can be an environmental swabs used to be, when I was way back in training, it used to be something that was recommended to be done regularly. But I think environmental swabs can be utilized in different scenarios. If there's a specific outbreak that the source of this bacteria is not known, so then a restaurant where a bunch of people got ill, they're not sure what was the cause, they identified the pathogen, so they would want to go back to that area and maybe do some environmental swabs. If in the agriculture world, it might have a role also if there's a flock of chicken that got sick or certain animals that died off mysteriously, then environmental swabs and carcass swabs can be of value. So there is definitely a role for environmental swabs, but it's not become routine where certain hospitals and healthcare settings used to ask for environmental swabs on a monthly basis. And we found that to be quite futile and not of much benefit unless there's a specific outbreak or cluster that is under investigation.
Thank you for a clear explanation on this. Also, Dr. Balki, today is World Toilet Days as well. So, is there any link between safe water, sanitation, and hygiene in regards to antimicrobial resistant prevention?
Actually, this is great. And we were very happy, even when we chose the dates, we were very happy that several critical days fall within the WOW week. The International Toilet Day is extremely critical because the whole issue of hygiene and sanitation, when it's not addressed, it allows for more opportunities of contamination of the environment and the unintended or the unawareness of exposure to bacterial pathogen. Of course, gut flora through defecation and contamination with human excreta is a major area to actually transmit resistant pathogens. So the toilet day is extremely important, and I hope that we can move quickly away from open defecation environments, which still exists in several countries around the world, not only for the human dignity part of that, which is extremely important, but also for mitigating the emergence of resistance, which this will continue to fuel into the AMR problem.
Thank you. I think we covered pretty much some of the important subjects around antimicrobial resistance, and you have already mentioned it at the very beginning of the program about the theme of this year's campaign. And I just want to reiterate that the slogan of this year's campaign is "Spread awareness, stop resistance." You already told us how to prevent antimicrobial resistance, but what about some other actions that we as an individual or organizations or countries can take to help WHO raise awareness on the issue?
Thank you for a great, maybe concluding question. But I think the first thing that I would like to request the audience is to be aware that this is not a silent pandemic. And we're trying to ensure that our partners and the organizations, and in talking about this situation, that we do not refer to it as a silent pandemic. It is for sure active. It has been a cause for death and disease for decades. And we continue to see new faces and new genetic codes for resistance among the different bacteria. So it's not silent. It's been going on for quite a while, and it's not something to prepare for the future. It's something to prepare for today. People are dying today from antimicrobial resistance. So preparation needs to happen now. So that's the first thing. I spoke a little bit about the role of the individuals by using antimicrobials only when prescribed, completing the course, for healthcare providers to do their best in identifying the cause of the infection through diagnostics when available. We need our scientists and researchers around the world to ramp up R&D in innovative ways to address hygiene, to address diagnostics, access to healthcare, infection prevention and control. So there's a lot of work, and I think that needs to be done. And we're still at the very beginning of trying to bring together the attention to AMR in a way more intensified fashion, finding the links with the needed healthcare systems, strengthening with primary healthcare, universal health coverage, all of these words, the supply chain. Even in high income countries, access to certain antimicrobials, especially the old ones, are not always available. And for the new antimicrobials, not all high income countries, and definitely many, if not all, of the mid-low income countries are actually not accessible. So we need cheap, affordable, accurate diagnostics. We need vaccine programs to help mitigate the emergence of viral infections so the misuse does not continue to take place. Regarding governments, maybe the last part, governments and politicians and financial partners and development banks to ensure that there is leadership and political support to the AMR agenda in mobilizing domestic and international funds to support the national action plans on AMR and to actually bring attention to the agenda and supporting it. What last statement that I would like to say is that we're working with partners to readdress the burden of AMR with World Bank and also with certain researchers and the IHME team, so that we can have more accurate and realistic numbers on the burden of antimicrobial resistance, so that when we do speak to our partners and politicians and financial partners, that we do have those numbers accurate and they can put the dollar against the activities that need to be done.
Oh, thank you very much. I think we are running out of time now, but before we close our live session today, I would like to give the floor back to you, Dr. Balkhi, if you have any last word for our audience, or perhaps if you would like to tell us about the upcoming WHO project to prevent antimicrobial resistance.
Thank you very much. I just like to thank everybody for being here, and perhaps they can take a look at our website and the WOW Week events. I think each individual has a major responsibility to at least educate themselves and to dispel the myths, that you were mentioning. There's so many myths. So how do we take the source of information from the real sources? I think the same thing that we saw with COVID is trying to dismiss the infodemics, trying to make sure that you're educated about what is really antimicrobials, antimicrobial resistance, to ensure that you are cognizant and aware of what's happening. With that, I'd like to thank you for organizing this event, and stay tuned for so many other activities. There's a lot of webinars that are taking place, and you can find them on our website. And I hope that you'll have the time to join and listen, learn, and spread the information.
Thank you very much. It's a very good point to end on. Remember, everyone, antimicrobial resistance can affect anyone, anywhere, and can happen at any stage of your life. All right, if you want to learn more about WHO's key areas of work and activities in the prevention of antimicrobial resistance, please visit our website, www.who.int. Also, we will share more fun and useful content about antimicrobial resistance across WHO social media channels. So please stay tuned. Thank you, everyone, for tuning in today from all over the world, as usual, from Bangladesh, from Pakistan, from Kenya, Colombia, Nigeria, Germany, Costa Rica, Rwanda, Jordan, Liberia, Brazil, Sweden, the Netherlands, Morocco, Australia. Thank you for sending in your questions, sending in your thoughts, and thank you very much, Dr. Balkhi, for taking the time to join and talk to us today.
Thank you, everybody. Have a good evening. Bye bye.
And last but not least, everyone, if you like this Q&A session, give us a thumbs up or share it if you loved it. Follow us if you haven't already on our social media platforms for latest activities from the World Health Organization. Thank you again. Have a good evening, and until next time.